Hi, welcome to Professional Certifications channel. Let's break down RHIA exam preparation, one topic a day for focused and effective learning. Today's topic is Critical Access Hospitals (CAH) in healthcare.
1. What is a critical access hospital, CAH? Let's start with the basics. What exactly is a critical access hospital, or CAH? A critical access hospital is a designation given by the Centers for Medicare and Medicaid Services, CMS, to certain rural hospitals that meet specific criteria. The CAH designation was created in 1997 as part of the Balanced Budget Act to help ensure that people in rural communities have access to healthcare services. It's a vital part of maintaining healthcare infrastructure in areas where hospitals might otherwise struggle to remain financially viable. To qualify as a CAH, a hospital must meet several criteria, including being located in a rural area, providing 24/7 emergency care services, having no more than 25 inpatient beds, and maintaining an average length of stay of 96 hours or less for acute care patients. Additionally, the hospital must be located more than 35 miles from the nearest hospital or more than 15 miles in mountainous terrain or areas with only secondary roads.
2. Key features and benefits of critical access hospitals. Now that we know what a CAH is, let's dive into the key features and benefits that make these hospitals so important, particularly in rural healthcare delivery. 1. Cost-based reimbursement. One of the most significant benefits of being designated as a CAH is cost-based reimbursement from Medicare. Unlike other hospitals that are reimbursed based on predetermined rates, CAHs are reimbursed at 101% of their allowable costs. This helps ensure financial stability and allows these hospitals to continue providing essential services to their communities, even with lower patient volumes. 2. Flexibility in services. CAHs have more flexibility in how they provide services. They can use a swing bed program, which allows them to use beds interchangeably for acute care and skilled nursing care, depending on the patient's needs. This flexibility is particularly valuable in rural settings where patient volumes may not justify separate facilities for different levels of care. 3. Focus on emergency and outpatient services. Given their small size and the communities they serve, CAHs often focus on providing emergency and outpatient services. This focus ensures that patients in rural areas have access to immediate care in emergencies and can receive necessary outpatient services without traveling long distances. 4. Community-centered care. CAHs play a crucial role in their communities, not only as healthcare providers but also as employers and hubs for local health initiatives. They often provide health education, preventive care programs, and other services that are tailored to the specific needs of their communities. This community-centered approach is essential for improving overall health outcomes in rural areas. 5. Collaboration with larger healthcare systems. Many CAHs collaborate with larger healthcare systems to ensure that patients can access specialized care when needed. These collaborations often involve referral networks, telemedicine services, and shared resources, helping to bridge the gap between rural and urban healthcare services.
3. The importance of critical access hospitals in rural healthcare. Critical access hospitals are vital to the healthcare system, especially in rural areas. Let's discuss why CAHs are so important. Improving access to care. CAHs ensure that people in rural communities have access to essential healthcare services. Without these hospitals, patients might have to travel long distances to receive care, which can be particularly challenging in emergencies or for those with chronic conditions. Supporting local economies. CAHs are often one of the largest employers in rural areas, providing jobs and supporting the local economy. The presence of a hospital can also attract other businesses and services to the area, contributing to overall community development. Enhancing health outcomes. By providing accessible, high-quality care close to home, CAHs help improve health outcomes for rural populations. They play a crucial role in managing chronic diseases, preventing hospital readmissions, and reducing health disparities between rural and urban populations. Emergency preparedness and response. In rural areas, CAHs are often the first line of defense in emergencies, whether it's a natural disaster, an accident, or a sudden health crisis. Their ability to provide immediate care and stabilize patients before transfer to larger facilities is critical for saving lives. Tailored health services. Because CAHs are closely connected to their communities, they can tailor their services to meet the specific health needs of the population they serve. This might include offering specific health screenings, educational programs, or preventive services that address the unique challenges faced by rural residents.
4. Challenges and future of critical access hospitals. While critical access hospitals are essential, they also face significant challenges. Let's talk about some of these challenges and what the future might hold for CAHs. Financial sustainability. Even with cost-based reimbursement, CAHs often operate on tight margins. Declining rural populations, changes in healthcare reimbursement models, and the high cost of maintaining facilities and staff can threaten the financial sustainability of these hospitals. It's crucial for CAHs to explore additional revenue streams, such as expanding outpatient services or leveraging telehealth to reach more patients. Workforce shortages. Rural areas often face shortages of healthcare professionals, including doctors, nurses, and specialists. Recruiting and retaining qualified staff can be challenging for CAHs, especially given the competition from larger urban hospitals. Innovative strategies, such as offering loan repayment programs, providing housing, or partnering with medical schools, can help attract healthcare workers to rural areas. Adapting to healthcare reforms. As the healthcare landscape continues to evolve, CAHs must adapt to new regulations, payment models, and technologies. This includes participating in value-based care initiatives, meeting new quality reporting requirements, and adopting electronic health records and other health IT systems. Staying flexible and open to change will be key to the survival and success of CAHs in the future. Telemedicine and technology integration. Telemedicine offers a promising solution to some of the challenges faced by CAHs, allowing them to expand their reach and provide specialized care without the need for patients to travel. However, integrating telemedicine and other advanced technologies into their operations requires investment and training, which can be a barrier for some CAHs. Building partnerships with larger health systems or technology providers can help overcome these barriers. Policy and advocacy. Ongoing support from federal and state governments is crucial for the survival of CAHs. Advocacy efforts to protect and expand funding, improve reimbursement rates, and address rural health disparities are essential. Engaging with policymakers and participating in rural health advocacy groups can help ensure that the needs of CAHs are represented and addressed.
Conclusion. In conclusion, critical access hospitals are a lifeline for rural communities, providing essential healthcare services, supporting local economies, and improving health outcomes. Despite the challenges they face, CAHs continue to play a vital role in ensuring that all Americans have access to quality healthcare, regardless of where they live. It's important to support these hospitals and advocate for policies that ensure their sustainability and success.